The National Center for Youth Law was established to address the serious problems that poor children face in America. More than 16 million children live below the poverty line, and 7.4 million of those children live in extreme poverty. Childhood poverty is linked to many negative outcomes in life, including less schooling, low wages, and poor health. These children desperately need our help. Many of these children end up being abused and neglected. There are about 500,000 children living in foster care. Many have unmet mental health needs that will plague them all their lives. Others will leave foster care only to become homeless. They are almost guaranteed to have trouble getting the education they need. Less than half even graduate from high school. Others may become caught up in the juvenile justice system, often for minor violations, putting yet another roadblock in their way. Our organization was founded to use the law to improve the lives of these children. We believe all children deserve resources, opportunities, and support to succeed in life. Our goal is to improve the lives of children in need. For abused or neglected children, we're working to improve foster care systems and, increasingly, to connect foster children to caring adults to ensure their educational success. We also strive to eliminate barriers to health and mental health care for low-income children, especially teenagers. We push for reforms that keep children out of the juvenile justice system when appropriate and promote approaches that serve and rehabilitate youth in their communities as an alternative to simply locking them up. The National Center for Youth Law is different from many other nonprofit organizations because we work to improve systems of care that serve hundreds of thousands of children. If we do our job well, those systems will be more effective for children without our continuing assistance, and we can move on to another system that needs improvement. One of our greatest strengths is that we have a broad range of strategies and tactics. We choose our approach based on what's likely to work best. In Arkansas, for example, local advocates asked us to help them file a lawsuit to improve the juvenile justice system. Instead, we found common ground with the governor and other key decision makers and are working collaboratively with them to implement reform. We provide training and technical assistance. We work to change policies so they are more effective in meeting the needs of disadvantaged children. And when necessary, we file lawsuits to hold agencies accountable for fulfilling their legal obligations to protect and serve children. In addition to our broad range of strategies, our talented, dedicated, and experienced staff makes us effective in our work. Our lawyers are the best child advocates in the country. They have chosen to make this their life's work. They are distinguished not only by their abilities and dedication, but by their willingness to sacrifice financially to do the work they love. We measure success by determining how many children have benefited from our efforts and whether those benefits are likely to endure. What this looks like varies from project to project. In our work to improve Washington's foster care system, for example, we measure success by gathering data on whether reforms are having positive results for children. In 2005, less than a quarter of all foster children were receiving timely and comprehensive health and mental health assessments. Now, because of our efforts, more than 90% receive those assessments. The percentage of foster children who are placed together with their siblings rose from about half to almost 90%. That's success. Some people think that all we do is sue people. That's because we've been successful in our lawsuits, and many of them have been highly visible. When you win cases in the Supreme Court, and you win cases with a broad impact, people think that's all you do. But that's not the full picture of who we are. Our goal is to improve the lives of children in need, and litigation is only one approach. In fact, it's always our last choice. We're problem solvers, and we prefer to work collaboratively with those who run youth-serving systems in order to improve the lives of disadvantaged children. We have significantly improved foster care systems in Baltimore, Arkansas, Utah, Washington State, Arizona, and California. That work has helped tens of thousands, perhaps hundreds of thousands, of abused or neglected children, and will continue to help thousands of children in the future. We have persuaded juvenile institutions to reduce their populations by placing teenagers who do not need to be in custody into community-based treatment, where they are much more likely to be able to turn their lives around for good. We persuaded the San Francisco Chronicle to launch an editorial campaign focused on the plight of children in foster care. Over the course of a 3-year period, the newspaper ran more than 80 editorials, which helped precipitate policy changes statewide and additional funding for services for abused and neglected youth. We helped win a Supreme Court victory on behalf of 450,000 children nationally who have chronic illnesses and disabilities, enabling their families to receive monthly income and medical insurance to meet their children's special needs. For many years, the National Center for Youth Law was funded by the Federal Legal Services Corporation as part of the nationwide system of providing free legal services to poor people. Because of changes in federal law, that funding ended in 1996, reducing our budget by 60%. That pushed us to be creative about how we fund our work, but we have risen to the challenge and now have a substantially larger budget with more resources and no government support. However, this means we must rely even more on the donation of private individuals. We would serve more children if we had additional resources. For example, we have been asked to bring our foster education initiative to Texas, which has nearly 28,000 children in its foster care system, and to Los Angeles, which has an even larger foster care population. These are the kinds of expansions we would love to do if we had more resources. There are several groups of disadvantaged children and teens that we are not able to serve effectively because we don't have enough resources. Immigrant youth whose parents are not in the country, sex-trafficked teenagers, a wide range of children with disabilities, pregnant and parenting teens, children who have challenges receiving governmental benefits to which they are entitled and which they badly need. We currently serve these groups to some degree, but we have the skills to do more, and we would love to do more if we had additional resources.